This is FCT Brief, and we're still discussing medical emergencies, and we'll still have with us Professor Mike Ogirima. Now, Professor Mike, you were saying something. Would you like to continue, or should I go ahead with another question?
With another?
Okay, another question.
All right. FMC, after the incident, they had a briefing yesterday, and they said they have feedback systems in place with QR codes and helplines available to patients. But how effective are these feedback systems, and do the patients even know that this is in place? All right, we seem to have lost connection there, but we'll get back to that. Now, this is what FMC is saying, that this, their QR codes, I believe their feedback systems, but I'm sure even some of the patients don't know that is in place, because if that person that made that video, I think 2 days ago, had known, I'm sure he would have tabled that to the appropriate authorities. Well, I'm sure that many of these patients don't know, and how effective is it even working in the first place? Even
a critical look at the press statement, it's so faulty in so many ways. The entire press statement did not even say anything about the condition of the patient. Yeah, the guy explained to journalists, but in the statement he released, he didn't even say anything about the patient. All he was concerned was the image of his institution. Who cares about the image of the institution? We're talking about the life of a citizen. You're talking about the image of an institution. Now, I think one of the reforms that may be necessary, not just in hospitals, in public facilities, is for us to have cameras in place. The lady was protesting when the camera zoomed on her. If we have cameras in place, I think it will help us. Cameras that are working, that we can always go back to see what happened in the course of the day.
All right, Mr. Ogirima, I hear that you're back now. I was asking you that the FMC, in their own response to what has happened, say that there are feedback systems in place, like QR codes, where patients can actually, give feedback if they are dissatisfied with services in the facility. Now, how effective is that feedback system, and do the patients actually know that this is in place?
Prof.
Mr. Ogirima.
A bit of a challenge there.
All right.
So we're just saying that, look, going forward, we have to move forward. And one efficient way, I also know that there's a particular bank, I won't mention the name in those days, that had hired people like mystery customers. And the mystery customers were going from bank to bank. You won't know that they were sent by the MD, and they will come in as normal customers. And whatever happens, they give feedback directly to him. And a lot of people were dealt with that.
Mr. Ogirima.
Yeah, I'm with you.
Okay, did you hear my question, or I need to ask it again?
Yeah, I understand the question, that how effective those feedback mechanisms. Yes, you may have all those gadgets there, which qualifies a center to be a center with medical legal environment. There must be officers who are in charge of those gadgets, monitor it 24 hours, and have a positive or a negative feedback. And our team manning the accident and emergency unit must be well trained. Drills must be on, frequently, so that they should be alert at any time. So where this is, absent in public setup, of course, the reflex will not be so sharp as to react to incidents. I am aware that some public institutions have frequent drills on emergency preparedness. Most, high-level private institutions do this from time to time. We should have this in our public institution. Frequent drills, simulation, and, good motivations of the staff, together with staff attitude. We all have ethics, for God's sake. We work with ethics of our profession. So, and one of those things that is common to all professionals is that you must be empathic. Treat a patient as if you are the one.
Now,
so,
okay. Go ahead, Prof.
So I expect that feedback mechanism must involve, changing staff attitude to work. Motivate them. But let me just add quickly. I have seen situations in some public hospitals where professionals go extra mile to help those patients, but at the end of the day, they are punished. Their salaries are deducted for allowing the patient to go without payment. Yet, the patients have been saved. So these are things that we should harmonize if we really want an efficient public health institution.
Okay,